We have been talking all morning long about this new pill that the FDA has approved for women called Addyi. Leslie is here with some special guests to talk about what it actually does.
Yeah, well, here this morning it's Dr. Irwin Goldstein, Director of Sexual Medicine at Alvarado Hospital, and a patient, that's Barbara Gattuso. Thank you so much for being here with us this morning. But we are talking about what is often called female Viagra, but it works nothing like Viagra. How does this particular pill that has just been approved work, doctor?
So Addyi is this fabulous new non-hormonal treatment for women with low sexual interest. It doesn't work by increasing blood flow like Viagra, as you mentioned. There are brain imbalance chemistry problems. There's too little dopamine and too much serotonin, and this drug reverses that. So it acts on the brain, not on blood flow, and it increases desire.
But women have different problems than men, so that's the first change for why they're so different from one another.
Well, women do have different problems, but men also have low interest problems.
So could they use this pill?
Well, we haven't studied it in women as we haven't studied in men as we studied in women.
Got it.
But it very likely could be used in men.
Well, let me bring up a controversy. Now, the FDA passed up approval on this twice, and so what is the reason behind that? Is it dangerous?
It's not dangerous. If they needed more information. They have never had a drug for women's sexual health issues. This drug is the first in the world. I mean, the FDA has approved something that no other country has approved in the non-hormonal treatment of women with sexual problems. We're now recognizing for the first time in history that women do have sexual problems. Actually, women have more sexual problems than men in epidemiologic
Well,
studies.
this does strike a nerve because the FDA has been accused of being gender biased. I mean, Viagra has been out for more than 15 years, and yet it hasn't addressed women's issues. Would you agree with that?
They're gender biased, as all, well, society is gender biased. It's very easy to talk about men, and it's very complicated to talk about women. They make women to be very different, and they're not very different. Men have complicated problems too. It has been difficult to do it, but God bless them. Janet Woodcock, head of the FDA, has said we now are wanting more safe and effective treatments for women with sexual health problems. That's rock star status.
All right, we're going to introduce Barbara in here. I mean, who are the right patients for this drug? We have Barbara. She is a patient of yours.
She is.
Morning.
Before we do, pink is the color. Here are your pink flowers for both you and Barbara.
Okay, thank you.
To celebrate the new pink pill.
Celebrating.
And
Celebrating,
she has
Barbara.
been on this medication.
And yes, tell us about it. What was your condition, and then talking about the effectiveness of this?
Okay, well, HSDD is a condition of low sexual desire. So in my case, I had an amazing marriage, wonderful husband, still do, and he stuck with me through this horrible, horrible turmoil in our relationship and our marriage for about 25 years. And you get up in the morning, you want to jump out of bed because you don't want your husband anywhere near you. It's like taboo, taboo, taboo. Although you love this person and you want to have a nice relationship with your husband, but the desire is not there. Where did it go? I don't know. Where did it go?
But this, you're saying, does work. You have been on the trial, and it does work for you.
It did work for me. Yes,
Okay.
I was on the trial, and I was on the placebo at first. Didn't know it. It was a double-blind study, like Dr. Goldstein indicated. And at the end of the study, he gave me the real pill, and within 2 weeks, everything came back. My desire came back. I wake my husband up in the middle of the night, actually. And
So you're an advocate for it. I mean, and measuring
yes.
success, I mean, I imagine is difficult, doctor, but measuring success is through trials and people coming out with testimonies like Barbara.
Correct, 100%. And the drug is safe and effective.
Side effects?
The side effects are traditional, those drugs that affect the brain: somnolence, tiredness, fatigue, nausea. Very limited problems. She didn't have any of these problems. The benefit clearly outweighs the risk, and the FDA has voted that it does have a benefit to women. And it's really exciting.
Well, doctor and Barbara, thank you so much for being here with us
Thank
this
you for
morning.
putting it on the air. We really
so
appreciate
much.
it.
All right.
Yes.
We'll be right back with more Good Morning San Diego. There you have it, a new drug approved by the FDA. Stay with us.